Controversy continues to swirl around the lack of details contained in the single-payer healthcare financing report prepared by the University of Massachusetts and submitted by the Shumlin Administration. At a Thursday morning press conference, a number of legislators and Jeff Wenberg of Vermonters for Healthcare Freedom laid out allegations and circumstantial evidence that points to the probability that the Shumlin Administration learned more than it cares to share with the voters about how the plan will be paid for and how much it will cost.
We are now seeking information that we know must exist, but has not been released by the administration. We are requesting documents also directly from the University of Massachusetts consultants under the Massachusetts Access to Public Records law. The legislature has requested this information. The taxpayers have now paid for this information, but for some reason the administration does not want you to see it, and now proposes to expend something like another $50,000 and waste another 2 years duplicating this effort.
The heart of the speculation is that the Shumlin Administration asked for research into how a combination of a payroll tax and income tax could finance the at least $1.6 billion in new taxes necessary to pay for single payer, but aborted the research when the numbers came back as politically and practically indefensible. Cynthia Browning, a representative from Arlington and an economist by training, crunched the numbers.
I also tried to look at what kinds of tax rates you might need under that scenario. Under the worst case scenario, you might end up needing like a tax rate on the income tax of 14%, 17%, and 20% on the low, middle, and high income bracket. If you decide you don't want the low-income people to pay an income tax to support the health program, you might then need a 20% or 24% rates on the middle and high brackets. And remember, that's on top of the rates we already have.
But Browning's criticisms of the UMass report didn't end there.
What I did is I went to the UMass study, and they made a whole bunch of favorable assumptions that made the tax burden of the new plan to Vermonters $1.6 billion. So I just tried to say, what happens if you make less favorable assumptions? I, in fact, think that UMass should have done that, and they probably did do that. They just didn't publish it, because any economist worth their salt explores alternative scenarios. So I explored the possibilities of what would happen to the number of the tax that represents the tax burden on Vermonters if you change the assumptions. The UMass assumptions gave $1.6 billion. If the administrative savings don't materialize, if the federal funding is not available, if people use more health services when they are cheaper, if there are startup costs, if there are reserve costs, I get a number of $2.3 billion.
Jeff Wenberg came to a similar conclusion.
You're looking at the principles that are in the report, the progressive tax principles that are espoused in the report, and then comparing that and contrasting that with the sum of money that they say needs to be raised, and then looking at a progressive payroll tax paid by employers and an increased income tax. We estimate that the payroll tax will have to be somewhere between 10 and 12% on wages, and the income tax on individuals in Vermont will have to more than double. It is understandable that if the consultants came to similar conclusions, why the administration would prefer not to release this information.